If you've been diagnosed with mesothelioma, one of the most important pieces of information is your pathology report, within which you'll find your cell type, epithelioid, sarcomatoid, or biphasic. This single detail has enormous implications for your treatment options, how well your treatments are likely to work, and your overall prognosis. Today, I want to explain exactly what these cell types are, why they behave so differently, what each means for your specific situation, and how your cell type should influence your treatment decisions. I'm Terri Oppenheimer, and I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice, but understanding your cell type is absolutely critical for making informed decisions about your care. So let's start with what cell type actually means. During the diagnosis process, you likely underwent a biopsy to retrieve a tissue sample for analysis. When pathologists examine mesothelioma tissue under a microscope, they're looking at the shape, arrangement, and characteristics of the cancer cells, and based on those features, they classify the cells into three main types: epithelioid, sarcomatoid, or biphasic. These categories represent fundamentally different types of cancer cells that grow differently, spread differently, and respond to treatment differently. Think of it like the difference between oak, pine, and birch trees. They're all trees, but they have different characteristics, they grow at different rates, and they respond differently to their environment. Epithelioid mesothelioma accounts for about 70% of all cases, which makes it by far the most common type. Under the microscope, epithelioid cells are relatively uniform in appearance. They look roughly square or rectangular, and they tend to grow in organized patterns, and they form structures that somewhat resemble sheets. The key to this characteristic is that these cells are more differentiated, meaning they retain some features of normal mesothelial cells rather than being completely transformed into chaotic cancer cells. Why does this matter? Epithelioid mesothelioma is the most treatable type. It responds better to chemotherapy than other cell types, and survival times are significantly longer, with a median of 18 to 24 months with treatment compared to under 12 months for other types. Patients diagnosed with epithelioid mesothelioma are also generally the best surgical candidates because the tumors are more likely to be resectable. That means surgery can remove the bulk of the tumor, and surgery usually provides better outcomes. Now, before I go on to the other variables, I'm going to take a break here to ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comment section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, for peritoneal mesothelioma specifically, epithelioid cell type is essentially required for cytoreductive surgery with HIPEC to be worthwhile. The excellent outcomes from this surgery, which are 5-year survival rates of 50 to 75% at experienced centers, apply almost exclusively to patients with epithelioid disease. Sarcomatoid mesothelioma, which accounts for about 10 to 20% of cases, is the most aggressive type. Under the microscope, sarcomatoid cells are spindle-shaped. They're long and narrow rather than looking like cubes, and they grow in disorganized, chaotic patterns and are poorly differentiated, which means they've lost most of the characteristics of normal cells. They look very abnormal and primitive. Sarcomatoid mesothelioma is extremely difficult to treat. It responds poorly to chemotherapy, with response rates much lower than with epithelioid disease. It also grows and spreads more rapidly. Median survival is often under 12 months and frequently under 6 months, even with treatment. Surgery is rarely beneficial because the aggressive nature of sarcomatoid cells means microscopic disease spreads early and widely. Even in instances where a surgeon can remove all visible tumor, sarcomatoid disease typically comes back quickly. The Checkmate 743 trial showed that immunotherapy with nivolumab and ipilimumab might work better than chemotherapy for non-epithelioid mesothelioma, and that provides some hope for improved treatment. But outcomes are still poor compared to epithelioid disease. For patients with sarcomatoid mesothelioma, the focus is often on quality of life and symptom management rather than aggressive attempts at cure. Because aggressive treatments provide little benefit and they can cause significant side effects and burdens. Biphasic mesothelioma, that contains both epithelioid and sarcomatoid components in the same tumor. This type accounts for about 20 to 30% of cases. The prognosis for biphasic disease depends heavily on the proportion of each cell type. If the tumor is predominantly epithelioid, say 70% epithelioid and 30% sarcomatoid, the prognosis and treatment response are much closer to that of pure epithelioid disease. But if the tumor is predominantly sarcomatoid, say 70% sarcomatoid and 30% epithelioid, the prognosis is much worse. It's closer to that of pure sarcomatoid disease. The pathology report should specify the approximate percentages of each component. This information is critical for treatment planning. Some biphasic patients are surgical candidates if the epithelioid component is predominant, but others aren't surgical candidates if the sarcomatoid component is predominant. Why do these cell types behave so differently? The fundamental difference is in the structure of the cells. Because epithelioid cells retain some characteristic of normal healthy cells and they grow in somewhat organized patterns, they're more vulnerable to treatment. They also grow more slowly, and this gives treatment much more time to work. They're more cohesive, meaning they stick together rather than spreading easily. Sarcomatoid cells have lost their normal characteristics and their regulation. They're more primitive and they're more aggressive. They're more resistant to chemotherapy because rapidly changing, undifferentiated cells have more ways to evade treatment, and they spread more readily because they don't stick together in organized structures. How is cell type determined? A pathologist will examine the biopsy or surgical tissue under a microscope. For straightforward cases, cell type is obvious. For ambiguous cases, the pathologist uses special stains and immunohistochemistry tests that identify specific proteins that are expressed by different cell types. Cell typing requires adequate tissue, and sometimes a small needle biopsy doesn't provide enough material for confident classification. If your initial biopsy was small and the cell type is unclear, your doctor is probably going to recommend that you undergo another biopsy to retrieve a larger sample before they make treatment decisions. This might seem invasive, but knowing your cell type is important. It's also important to have your pathology reviewed by a mesothelioma specializing pathologist. Mesothelioma is rare, and cell typing can be subtle. Community pathologists who rarely see mesothelioma might misclassify your cell type. Having slides reviewed at a specialized center ensures accurate classification. How should cell type influence your treatment decisions? If you have epithelioid mesothelioma, pursuing aggressive treatment, including consideration of surgery at a specialized center, could be a good choice. You're also likely to benefit from chemotherapy or immunotherapy, and clinical trials are also an appropriate option. the potential for meaningful life extension justifies aggressive treatment approaches. But if you have sarcomatoid mesothelioma, surgery is rarely beneficial, and you should be skeptical if a surgeon recommends it without acknowledging the poor outcomes that are typical for sarcomatoid disease. Immunotherapy might be worth trying based on the Checkmate 743 results showing better outcomes than chemotherapy for non-epithelioid types. But you should also have a frank discussion with your oncologist about whether aggressive treatment will meaningfully extend survival or just create a burden without a benefit. Many sarcomatoid patients choose to focus on their quality of life, symptom management, and palliative care rather than aggressive treatment that's unlikely to help. If you have biphasic mesothelioma, ask specifically about the percentage of epithelioid versus sarcomatoid components. If it's predominantly epithelioid, consider pursuing treatments similarly to pure epithelioid disease. If it's predominantly sarcomatoid, be more cautious about aggressive treatments. Can cell type change over time? Rarely, biphasic tumors might evolve to become more sarcomatoid over time as the more aggressive cells outgrow the epithelioid cells. If you had surgery and your pathology showed mixed cell types, subsequent recurrence might be predominantly sarcomatoid. This is one of the reasons why recurrent disease is often harder to treat than initial disease, not just because you've already tried treatments, but because the tumor biology might have changed. What questions should you ask about your cell type? Start with what exactly is my cell type, epithelioid, sarcomatoid, or biphasic? If the doctor is unclear on this, ask whether a larger biopsy would provide better cell type information. If it's biphasic, ask about the approximate percentages of each component. You should ask whether your pathology has been reviewed by a mesothelioma specializing pathologist and how your cell type is affecting your physician's treatment recommendations. Also, ask how it affects your prognosis. To review, mesothelioma cell type, epithelioid, sarcomatoid, or biphasic, is one of the most important prognostic factors for patients. Epithelioid, which is seen in 70% of cases, is most treatable and has an 18 to 24-month median survival, good response to treatment, and the best surgical outcomes. Sarcomatoid, which is seen to 10 to 20% of cases, is the most aggressive, with an under 12-month median survival, poor treatment response, and surgery is rarely beneficial. Biphasic, which is seen in 20 to 30% of cases, has an intermediate prognosis depending on component percentages. Your cell type should heavily influence your treatment options and your decisions. Visit mesothelioma.net for detailed information about mesothelioma cell types and treatment, or call 1-800-692-8608 or use the live chat feature on the website to work with one of our patient advocates right away. As for me, remember to post your questions below, and I'll see you next time.